Welcome to McDougall. If you've ever thought about going to a chiropractor, you'd better watch this show. Hello, I'm Wayne Judd, and now here to bring you your daily recommended allowance, Dr. John. So, how are you, John?
Well, I'm just fine.
Good.
Just fine. I was just thinking about all the things that I learned in medical school
And forgot.
that were incorrect.
Oh.
That were incorrect. You know, this is one of the most disturbing things about being a doctor who gets an education after he leaves or she leaves the formal training is you resent the fact that you were taught things that were incorrect. And one of the things that is most troubling to me is the fact that I was taught diet had nothing to do with arthritis. Have you ever heard that statement from doctors or from you know, on the television or in brochures? Actually, the Arthritis Foundation used to put out a brochure, The Truth About Arthritis, that said that diet had nothing to do with the cause or cure of arthritis.
Well, in fact, that's true, isn't it?
Well,
I'm not so sure that I
you
haven't
hear it
believed
so
that all my life.
often, you know, you hear it so often, you'd think, yeah, it has to be true. And what I feel bad about is all the doctors who are confronted by patients. Patients came in and said, "Doctor, you know, I think that this food bothers my arthritis." And the doctor told the patient, "Oh, that's all nonsense." And the doctors missed an opportunity to really help their patients because of this kind of misinformation that's out there.
Interesting.
And I feel sorry not only for the doctors because they couldn't have helped, but I feel sorry for the patients because they had to suffer terrible arthritis when the information is the contrary. I went, and about 18 years ago when I first started researching this, I went to the medical library to look for the strong supporting evidence that allowed organizations like the Arthritis Foundation or all the rheumatologists across the country to make this strong statement diet had nothing to do with arthritis. And you know, after thorough research in one of the best medical libraries in the country,
You didn't find anything.
I came out empty-handed. There wasn't a single article that said it. But I came out with a stack of articles. It wasn't real big, but it was big enough that said that diet not only caused arthritis, like rheumatoid arthritis, but diet could cure these people or dramatically improve their situation.
John, let me tell you, since you mentioned it, I, not too long ago, went on what is known around the nation as the McDougall diet.
I've heard of that.
You've heard of the McDougall diet?
Yeah. I approve, too.
A year ago, I stopped playing tennis. I was playing tennis 4 times a week. My knees became so inflamed and bad that I wasn't able to play tennis anymore. And in the last couple of months, since I've changed my diet, I've been going out playing some tennis again. Is it any possibility that this could be a connection with my...
I would say so. Inflammatory arthritis, the kind of arthritis that's hard to help is the kind that's due to a lot of destruction of the joints. That's difficult because that's permanent damage. But the kind that's really easy to help is the one that has a strong inflammatory component.
Right.
Where when you take x-rays, the joints look good.
They looked good. In fact, I did that. I was scared to death. I found myself in a medical office talking to a specialist, one of the finest specialists in the country, because I love tennis.
Right.
And he said, "There's nothing wrong with your knees. They're fine." But no one referenced diet. And they hurt, and I knew they hurt.
Right.
I could hardly walk or climb
I've heard
stairs.
this story over and over again, you know, knee problems, hip problems, shoulder problems of people who really weren't bad enough to get a diagnosis. They didn't say you had rheumatoid arthritis or you had ankylosing spondylitis or lupus, but you know, you had obviously pain and you obviously had arthritis. Changed their diet, got well. But the really important thing is there are people who have these labels: rheumatoid arthritis, lupus, ankylosing spondylitis, psoriatic arthritis, inflammatory arthritis, that are missing an opportunity that's well laid out in the scientific literature, and that is to change their diet to get tremendous improvement, and in many cases when you can only use the word cure. Now, I'll give you a good example. There was an October 1991 issue of Lancet that published as their lead article a study on a 1-year vegetarian diet in rheumatoid arthritis, and in 1 week, all of the objective and subjective parameters improved, and things like
in
pain,
1 week.
1 week,
not a year. 1 week.
1 week.
Amazing.
Of all the patients. Sedimentation rate, which is something that doctors measure for inflammation.
Sedimentation meaning?
Well, it's really not important.
You don't care.
It's a blood test they do that every arthritis patient knows about.
Okay. All right.
The swelling of their joints, the stiffness of the joints, the pain in the joints. All these things changed in 1 week of a change in diet. And there are multiple studies out there that are published on cases and small groups of patients who have these inflammatory arthritises who change their diet, who get tremendous benefit, better than any drug available. And the sad thing is there's not the economic interest to do the proper studies that ought to be done, where we take large groups of people, put them on a good diet, and compare them with people who don't go on a good diet. There's just no incentive from any part of industry to do that. And so it's likely people will continue to have their joints destroyed, continue to suffer, until there's enough information accumulated so that every doctor is going to have to scream, just like they do today with diet and heart disease. Every doctor is going to have to scream out to their patients, yes, it is true that arthritis is caused by an unhealthy diet, and yes, you can do something for yourself. I hope that day comes soon, for the patient's sake as well as the doctor's sake.
Good stuff, John.
Well, I'll
Good
tell you,
stuff.
it's fascinating to be a doctor that has this kind of information, and the patients really appreciate it. And stay tuned with us. We have an exciting discussion on chiropractic medicine. We'll be back in just a moment.
You can learn English at home. Watch Hello Channel.
And welcome back. Our discussion, chiropractic medicine, and we have a couple of doctors of chiropractic medicine with us here. We have Richard Reese and also Rick Sears, who practice in Thousand Oaks. Now, you know, there was a day when to be a medical doctor sitting next to a couple of chiropractors in this situation, I would have risked my reputation, if not my license.
Yeah.
But things have changed a lot, haven't they?
Well, I think due to shows like this in the last 10, 15 years, you have quite a bit of the news media showing people that chiropractic is safe and effective, and quite a few studies that are done not just by chiropractors but by MDs as well, specifically one that just came out in December of last year of '94, where the Department of Health and Human Services fortified pretty much the chiropractic tenets of manipulation for acute low back care being superior to acupuncture and even in certain cases physical therapy.
Yeah, but why is it that the chiropractic profession has gotten such a bad reputation?
Well, I think it has a lot to do with the training of chiropractors, let's say at the turn of the century. And actually, at that time when chiropractic was officially formed in Iowa, most of the chiropractors that were learning anatomy and physiology were really not too well versed in medicine, pharmacology, and many of the same classes that students in medical school.
Well, I'll tell you, if you're too politically correct to say it, I'll say it. It was an orchestrated campaign against chiropractors by medical doctors.
I think that
That's what it was.
It was. And
It was. And there's
true,
no
and it's
question
come
about
out.
it. And there have been some legal cases, they're very important legal cases that have helped establish the fact that the medical profession has tried to put the chiropractic profession out of business.
That was Dr. Chester Wilk of Chicago, and I believe the settlement was about 5 years ago. And that had to do, I think, with the fact that we were heading towards managed care, and that there was an economic reason why the AMA, or the Medical Association per se, was so horrified that chiropractors were taking part of their business away. I mean, 80% of doctors' visits today constitute headaches, back pain, neck pain, many musculoskeletal complaints, as you were talking about
Competition.
earlier. Right, exactly.
Yeah.
But the thing is patients keep going back to chiropractors, and the reason chiropractors have such great businesses has to be one thing, as far as I'm concerned, the bottom line, and that is that the patients are satisfied.
They are satisfied.
And so,
That's right.
you know, that speaks louder than the medical business does toward the chiropractor.
That's
But
right.
things are changing, and I see clinics around where medical doctors and chiropractors are working hand in hand to take advantage of your skills.
That's right. In
What do
fact,
you think you guys could help most? I mean, if you had an ideal patient walk in your office, what would you like to see? Because you know that patient's going to leave with the biggest smile if you get to treat them.
I would like to see a little bit of low back pain.
Low back pain, good stuff,
yeah.
huh? There's
Yeah,
literature supports that too, doesn't
Yeah.
it?
We can take care of somebody that's walked in with a little bit of pain that's, you know, really kind of bother them at home. We could bring them in, and after a few treatments, they're feeling great.
I think that one of the things that people see, that there tends to be a specialty, and that is that chiropractic treats low back pain. 47% of our patients are low back pain patients. 40% might be involving shoulder, neck, and 12 to 13% may constitute other ailments. But specifically, 87% of our clientele will be people that have acute low back, neck, or other shoulder extremity problems.
Now, chiropractors, they differ in the schools they've been to. Just like medical doctors are going to differ in their, their bedside manner, their qualities, and so on. Is there any advice that you'd give somebody that was seeking a chiropractor to help them? I mean, how do you sort through the good and the bad?
Well, I think first you got to go by referrals if you can.
Kind of reputation.
Reputation, sure. Anybody that's recommended somebody that's to a
Should you
chiropractor's
feel
getting results.
better, and once you initiate this contact with a chiropractor, I mean, should you take the attitude that you ought to feel better when you leave the office than when you went in? Because I have to tell you, too many times I've had experiences, and so have my patients, where they've felt worse when they left after the treatment. Or is that part of the treatment?
Well,
Not painful, it doesn't work, right?
Well, I know, personally, I like to see them walk out with a smile on their face, but sometimes it's like you do the treatment, the therapy, the manipulation, whatever, and they leave, and they might have a little bit of a, it's kind of like exercising for the first time. You're changing things in their body. There's some structural changes. The muscles are changing.
Well, that popping noise, I mean, it makes you think something's happened.
Yeah.
I think the patient oftentimes will feel discomfort after treatment, but I always tell them you're going to feel discomfort if you have an injection, you're going to have discomfort if you have surgery. There's changing occurring in the body, as Dr. Sears talked about.
And is it just the manipulation of the bones, the popping sensation, the realignment that makes a difference, or do you think something a little bit more complicated than that's going on? I guess the chiropractic business has some theories about changing the nervous system when you, can you explain that to me?
Well, I would like to...
Or am I going too
No,
far?
no, not at all.
No, you're right.
I don't want to lose the audience on this, but I'd like to use the example of a musician or somebody who's taking a music lesson for the first time. You don't know quite where the keyboard's located. As you play those keys and you know where the fingering is supposed to be, you can close your eyes. You don't even have to look at the keyboard. And the same thing is true with alignment of vertebra. What happens, the nervous system has its own memory of where those vertebrae should be. And when you position them as a chiropractor and you're doing it repeatedly, you're introducing this new information, and it's the same thing. The body's learning where that position should be.
We think of chiropractors as mainly doctors who manipulate people's bones, crack the neck, and so on. But actually, a chiropractor does a lot more in the practice to help people.
Sure, we evaluate people when they come in. We see what their problem is, and we listen to them. We listen to their problems. Then we actually touch them. We're doing a little bit of massage or palpating, feeling to see what the problem is. And I think the patients get a lot out of that also.
You probably also spend time with them, too.
Time.
I mean, when you write a prescription, you can get them out of there in 30 seconds.
Yeah.
Exactly.
But you guys have to talk to them.
Right.
Well,
I've always felt that oftentimes people will say, my chiropractor or my MD walks in, spends 2 minutes, and out he goes. You can't evaluate.
chiropractors do that too?
Some of them do.
Just go in, pop, and out of the door?
Exactly. And,
So-
and you can't evaluate how a patient's doing if you can't ask them, how are you feeling?
Right.
What's been going on with you since the last time I saw
Well,
you?
you may not realize this, but a lot of medical doctors these days are learning that too, and we're starting to talk to our patients also.
Good.
Right.
And getting better results. There's a lot to the chiropractic business, and Rick Sears and Richard Reese are going to tell us about it. They brought some interesting demonstrations along for us, so stay tuned. We'll be right back.
I remember a time when I wasn't being very nice to one of the girls at school. I didn't think it was a big deal. But in one sentence, my mom helped me understand. She said, "Mija, you need to treat others the way you want to be treated." I thought about that a lot. I still do.
Life's most important lessons are best learned in the home. A message from the Church of Jesus Christ of Latter-day Saints.
Learning a new language can be difficult and discouraging, but it doesn't have to be. Hello, I'm Karen, introducing Hello Channel, the revolutionary new channel designed especially to teach English. If you can speak English, the future is open for you, since speaking English means greater opportunity and higher paying jobs. By watching Hello Channel, you are immersed in this valuable language. You'll hear the words being spoken. You'll see the speakers' mouths when they say the words. You'll read what's being spoken in large, clear subtitles. and you'll speak out loud, practicing what you have just learned. There is no better or faster way to learn a language than total immersion. Hello Channel does exactly that. There's programming on every level, so you can watch the shows that are just perfect for you. Whether you've spoken a little English, a great deal of English, or none at all, the Hello Channel has something for everyone. Join us for a convenient, affordable, and fun way to shape your future. There's so much in store for you if you'll just say hello.
And welcome back. The discussion is chiropractic medicine with us. Richard Reese and Rick Sears, they practice in Thousand Oaks, California. And we're talking about the benefits of chiropractic medicine. But one of the more striking things of chiropractic medicine, anybody who's been to a chiropractor, is they have the experience of popping bones. What is actually going on there when you twist somebody's neck, which you really can hear, you know?
Well, first of all, the idea of the release of the vertebra, sometimes it will be an audible, as we call an audible release or audible click or pop. But basically what that is, the vertebra has two joint spaces on each side, and the vertebra is tilted to one side. Obviously, one side is narrow, one side is gapped. Mm-hmm. And the idea that when you're realigning the vertebra, you're not cracking or making that kind of noise. It's basically the joint space on the side that's narrowed is jammed together. The muscles are relaxed. The patient's in a passive situation. The vertebra is relaxed, and you hear this popping or gapping noise. It sounds like a click or a pop because obviously it's
not
a small
bones
joint.
rubbing together.
No, of course not. And oftentimes, obviously, because the vertebra being so close to the neck and you're adjusting the cervical spine, that sound reverberates because there's bone conduction of sound as well as...
So no risk of breaking a bone?
Not at all. Not too many Arnold Schwarzenegger movies, I think. But there's no chance of that happening.
One of the things about chiropractic medicine that's come to my attention many times is the X-ray machine. It seems like most chiropractors have an X-ray machine. Having an X-ray machine in your office, whether you're a medical doctor or a chiropractor, brings about the question as to whether too many X-rays might be ordered. Because after all, every time you turn that switch on, you make $50, $100. And so the patient worries about it, and the question of ethics has come up many times. Is that X-ray machine necessary for the practice of chiropractic medicine?
Well, I think in some cases it is. I know that in our office we don't X-ray everybody that comes in.
It's not routine, because some chiropractors I've heard say, unless you get the X-rays, I can't treat you.
Well, that's a medical legal issue, and I think that, for instance, if we belong to a managed care organization and they say that you're going to have to take an X-ray on each patient because we're not assuming the liability, you are, and we won't take you on as a member of our panel unless you are accepting that liability. So you see, it's a medical legal issue. Obviously, if you're a 25-year-old aerobics instructor who's pulled a hamstring muscle, there's no point in X-raying. But if, as recently, having a gentleman who was 63 years old come in with lower back pain for several months, who was up at night from the pain, that's a red flag. X-rays showed he had metastatic tumors.
Oh boy.
So there is a time and place for each decision.
The other criticism that, of course, you got to understand, you're talking to a medical doctor, that I've heard is that the X-rays are not of good quality. Is that still true today?
I don't think so.
You know, because radiologists will often say that, is that the X-rays taken in a chiropractor's office are not of good quality, not worth the film they're printed on. I've heard it many times.
Well, I don't see how that could be. We have a fairly new X-ray. We have rare screens which show up the X-rays faster, and so you don't need as much X-ray. They're very clear.
And
you had a problem
get a lot of training in reading the X-rays?
Oh, absolutely. In fact, our particular instructor has been invited several times by the American College of Radiology to speak at their conventions. So he's held in high esteem, not just by our profession, but also in colleagues in the medical radiology field.
But considering the way medicine, on both chiropractic and standard medicine is practiced, I don't think a patient should leave down their guard and not question whether or not the X-ray is necessary. Do you?
Oh, I absolutely think the patient's rights should supersede any treatment plan, and it's up to the patient to decide whether they want. But understanding, of course, there's risk and benefits with any decision.
You brought some other things along too. It's not just cracking bones that you do.
Well, we like to push prevention, and there's also, because low back pain and neck pain are also multifaceted things. We take cardboard boxes, so we're very environmentally conscious in our office. So instead of throwing things away like these boxes, we tell patients who have chronic low back aches. This is not something that is acute. Understanding this is pain that you've had. Let's say that you drive back and forth to work every day. You have a 2-hour commute, or you sit at a computer all day long, and it's uncomfortable to sit on soft chairs. Soft chairs are bad on your lower back because when you sit on a soft chair, you're not sitting on the ischial tuberosities, those bones that we feel when we sit on something hard. That's what you should be sitting on. When you sit, you take a box like this and fold it into something flat, perhaps a 4 layers thick of cardboard, and you put it on your chair, you're going to feel immediately that the pressure's taken off the lower back area. And by doing that, therefore, you're not causing compression right at the lower back disc space where it's so often causing many back problems.
So you said this was just for low back, not for neck pain? You can't use this at all for neck pain?
This is specifically for people that have chronic low back. Just put it in your car, try it. Just try it in your car, try it at the computer terminal, and see if it doesn't take some of the stress off that lower back ache.
One of the biggest problems that I see that I can't help people with, and hopefully you have a solution, is problems of sciatica. Does chiropractic medicine offer a good solution there?
Sure, we can take care of lots of cases of sciatica. First, we would have to do an evaluation, a workup to decide whether or not chiropractic could actually help that problem. Then, as we take care of the patient after a few treatments, that will usually
and is
take care of itself.
Back manipulation we're talking about?
Usually back,
all
yes.
Right.
A little bit. We would work with a little bit of physical therapy to relax the muscles, because a lot of times there's a muscle spasm.
Other problems that chiropractors really enjoy seeing. We've got back pains, neck pains is obvious, sciatica. You deal with torn muscles, injuries to muscles?
Well, sure. Torn hamstrings. We frequently
trauma. You get a lot of trauma cases too, don't you?
Absolutely. Particularly in the summertime, people are water skiing. Let's say they're in a softball league. We treat a lot of rotator cuff tears. And it's best to treat those things without surgery and using surgery as an ultimate last resort.
Well, things have changed a lot in terms of chiropractic medicine, in terms of the support that they've gotten and by the rest of the medical establishment, and also support by insurance companies. And that's what I want to pick up on when we get back.
For a brighter future, say hello.
And welcome back. Our discussion is chiropractic medicine. We have Dr. Richard Reese and Rick Sears with us. I had an experience with a chiropractor one time. I have a weakness of my left leg, and the chiropractor told me that he could help my problem by one of those light techniques, light touch techniques. Brought me in, spent an hour doing the light touch technique, got done with the whole evaluation, or got with the whole treatment, and then evaluated me and found out my leg was still weak. And he looked up at me and says, you're going to have to exercise. And I said, no, I don't want to hear that. I said, I want you to twist me, fix me. I didn't like that at all.
Yeah.
So part of the appeal of chiropractic medicine as well as standard medicine is to get fixed. But I imagine in your business, you guys have to ask people to take some responsibility for their own health, don't you?
Oh, absolutely. Whatever we do in the office has to be supported outside the office. And because neuromusculoskeletal problems are so much dependent on lifestyles, they have to change those bad habits.
That's a good note to end on. Richard Reese and Rick Sears, you guys are obviously enjoying your practice very much. And I'm really thrilled that medical doctors and chiropractors can have good discussions and work together. Patients need the best we can get.